When I look inside of a child's eye in Boston, or I look inside of a child's eye in Mongolia, there is absolutely no difference.
Dr. Bruce Moore has spent 5 decades helping children see in Boston as a leading pediatric optometrist, but the need he's found overseas is not like anything he's seen before.
This mom was so committed to bringing her 2-year-old child from 1,800 kilometers away by bus for 26 hours to see me. Now, I never had that experience in my life.
What's different is access to care. It's truly a world apart, and that's where Orbis International comes in. The nonprofit organization serves countries with limited resources, fighting blindness and restoring vision for many where quality eye care is just out of reach. That includes their flying hospital, a plane fully equipped with laser technology, a simulation lab, a modern operating room, and a classroom to broadcast surgeries live to trainees around the globe.
It is a hospital with wings. We bring our patients on board, we bring our trainees on board, and we are teaching right there in the hospital.
More than 400 medical experts volunteer with Orbis every year, training nurses and doctors in 32 countries on and off the plane.
We're reaching them where they can learn in their own environment, in their own operating room.
Organizers say a nursing program they created in Zambia has now doubled the number of patients getting care every day.
It's not how many surgeries we can do while we're there, it's how many they can do after we leave.
To be able to teach and monitor the ability of some of the local ophthalmologists and come up with accurate refractions as really a very basic part of eye care.
Without that training, a child may go years without glasses, which can stall their progress in learning and in life.
They understand that child health is critical to moving their country forward.
According to the National Institutes of Health, 90% of vision loss is treatable or preventable, but 1 billion people still live with it, and most are in low and middle income countries. Moore says after 50 years of work, he's still motivated to reach as many people as possible.
To be able to be at this point in my life, in my career, and still be healthy enough to be able to go to places to have high impact is to me the very best thing that I could possibly have done in my life beyond my family.
Yeah, Moore has been working, by the way, with the government of Mongolia to initiate a system of vision screening and follow-up care for kids there, not just in the cities, but also in outlying areas. He even helped open the first ever Orbis Mongolia Vision Center there. By the way, Orbis is always looking for volunteers. We put a link to more information with this story on our website and the WCVB app.